Hello, everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachowa, and I partner with them to bring you an easy and educational workday session. Today's session is how to prevent neck and back pain while WFH, working from home. A little bit about me. I'm a doctor of physical therapy. I own PAR5 Physical Therapy here in Randolph, New Jersey. And my mission is to help active adults get back to doing the things that they love to do without pain meds, injections, or surgery, even if you've tried physical therapy before. I know a lot of clients in this past week have reached out to me and with neck or back issues, and they've said, I've tried PT before, it really didn't help. And, I see a lot of that here. A lot of clients that come to see me have been through the physical therapy, track, tried it out, didn't help, but I'm able to help them with a lot of the skills that I have because I have a doctorate in physical therapy, but also I'm a certified dry needling specialist, an orthopedic clinical specialist, and a certified golf medical professional. So moving on. Now, let me pull up my slides here. Pop that open. Awesome. So this is how to prevent neck and back pain while working from home. All right. So just like every other class that I've had, I have to put this disclaimer up. So if you are dealing with something specific, an injury, post-surgical, something like that, and you have specific questions, you could always ask them here. But the stuff that we're going to be covering today is geared or aimed at a broad population of people, right? The general public. So if you're dealing with something specific, please seek out a medical professional to have a thorough physical exam so that they can get to the root cause of your problem and find out why you're having any issues. All right. Now, if you've been to any of my classes as well, you're probably familiar with the next slide. I am telling you that this is the one thing that you need to remember. If you remember anything from my class, it's that the body functions on this alternating pattern of stability and mobility. I'll say it again. The body functions on this alternating pattern of stability, mobility. If this pattern is disrupted, pain or injury is usually the result. So today we're focusing on the neck. The neck is actually a very mobile segment of our body. It's, pretty small bones in the joints in their neck. It's divided into two parts. It's actually not on this slide here, but the lower cervical is supposed to be a stable segment, and the upper cervical is supposed to be a mobile segment. So that kind of goes into this pattern here of stable, mobile, stable, mobile, stable, mobile, starting from the foot. And you can see how that pattern goes up the chain through each segment, where you have a mobile segment followed by a stable segment. For example, for the lower back, that's defined as a stable segment. And usually people come to see me with back issues. It's not because of the back, but because of something else, whether they're dealing with tight hips or a tight thoracic spine. That typically is the root cause of why people have back pain when they come to see me. And they go to physical therapy or they go to a chiropractor and they address their back pain. They treat their back. If you only treat one thing, the root cause is not going to be addressed. So we also need to treat everything above or below that segment. Make sure that the thoracic spine is mobile as possible and your hips are as mobile as possible. For the neck, the thoracic spine needs to be mobile, the lower cervical needs to be stable, and the upper cervical needs to be mobile. All right. Another thing that you have to remember is that our bodies will adapt to the positions you put them in. So it's just posture, right? So you're going to be sitting, standing, whatever throughout the day, whatever position you assume, the more you are in that position, your body adapts to that position. Another thing that I like to tell people is that connective tissue in the body, primarily fascia or myofascia. Fascia is this connective tissue that gives our body its shape. It's sort of like a sweater-like or spider web material that fills in all the gaps. It gives our muscle its shape, and our muscles are in envelopes of fascia. Fascia or muscle without fascia is basically hamburger meat, just deformed meat, right? And this fascia gets broken down and built up throughout the day, depending upon our activities and positions. So that's why we often feel stiff and achy in the morning, because we haven't moved for like 6 to 8 hours. And that fascia can get very sticky. It can get very dry and not mobile. It thrives on motion. And the more that you move and stretch, the more that we break up those adhesions between those fiber layers in our fascia, lubricate those areas, and then we have more mobility. We feel less tight. All right. And, the one thing about perfect posture, we'll talk about working from home in a moment in terms of the position that your body needs to be in to function properly. There is no such thing as perfect posture. A lot of times people will look at this type of diagram here and look in that middle slide, the middle picture there where it says, this is the correct sitting position, right? And it's like, all right, there's a lot of 90-degree angles there. Feet are flat on the ground. The knees are bent. The hips are even with the knees. The back is straight. The shoulders are down. And the desk or whatever you're using, your workstation, is at elbow height. And that's fine. I think that's a pretty good position to be in. But like we said 2 slides ago, your body will adapt to the positions you put it in. So if you're in this position, which is your ideal ergonomic desk setup, then you're going to be adapted in terms of elbow bent 90 degrees and also knees bent and hips bent 90 degrees. And the other things should be said for standing, right? Standing position here, we've got elbows bent 90 degrees and you're a little bit more vertical. I like both of these, right? That's why they have the green check mark. The one all the way on the left here where you're slouched forward, your head's forward of your shoulders and you're really rounded with the back, that's not good, but it's not wrong, right? It's not wrong. Your body physiologically can get into those positions. If we couldn't, then we wouldn't be able to look like that. But again, because we spend so much time there, that's how our body adapts. So every 30 minutes, if you're sitting, or every 60 minutes, if you're standing, that's the limit that we want to stay in that one position. Movement is medicine. You probably heard that before. And we want to keep moving. Even if you're sitting, I'm going to give you a couple of tips and tricks to do while you're sitting. So you don't have to get up out of your Zoom meeting or whatever. You could still stay productive, but not adapt into that one position. All right. So when we go through these things here, rule is that they should not hurt. There should never be any pain with any exercise or any intervention. I always tell clients that come in, they say, hey, no pain, no gain. I'm going to work out so hard. That's not the case. Because if there is something, pain is our signal, our body signal, that it requests for a change, right? So if you're feeling pain with any of these exercises or things that we're going to go over, we got to modify them. There's an infinite number of modifications and scaling options for you for these exercises that shouldn't be painful. And the other thing too is that consistency breeds the change. So you want to try and fit these exercises in throughout the day and breathe naturally, deep breath in, deep breath out, to relax the muscles and the joints so that we can create a permanent change. All right. So next we're going to look at lumbar spine, primarily lower back, and the cervical spine. All right. So let's pull up my 2-shot here. And I've got my ergonomic chair, right? We got this camera going on. And I think I could pull this down and you could see me from a different angle as well. All right. So let's think about some things that you can do to avoid or prevent any neck pain or back pain when you're sitting. So most people have some type of chair like this for work. It may have a little bit of a lumbar support and a little bit of switch on the side here to unlock and recline. That's fine. Movement is always good. If you want to lean back, that's great. But again, we want to change positions often or frequently. So what I like to do is, this is good, and you can kind of adjust a lot of things. Different chairs have different features. But for our purposes of getting into these exercises and stretches, I want to lock that up. So I'm not going to be rocking back. It's going to be stable. So our first thing is to sit as far back and deep into the chair as possible. Oftentimes we'll be here and then leaning back. There's a lot of space between my spine and or my hips in the back of the chair. What we want to do is get our back here. Our pelvis is locked into the corner of the chair. And then I'm going to lean up. And my chair, depending upon your model, puts my back into a lot of extension. It goes backwards a bit, and that's fine for this exercise. For this exercise, we're going to concentrate on that thoracic spine, all right? That thoracic spine, our mid-back, where our ribs are, need to be mobile. So we're going to stretch that out. We're going to keep the hips down. The legs will not move. This is important. The hands will go behind the head. I'm interlocking the hands behind my head. And another key point is the elbows need to go forward. And what this allows us to do as we pull the elbows forward is to create a lot of tension in the muscles in the upper back. If we create tension in the muscles in the upper back, what's going to happen is that when we do this move, it's going to manipulate and mobilize the joints in our mid-back and not just stretch the tissue. All right, so this is how you pop your own back, maybe. All right, so we're going to have those elbows nice and tight and forward. All right, and then from here, without moving the hips, I'm going to lean back, and depending upon how your chair is set up, how high the back of the chair is, you might get a little bit of fulcrum off the top end to work at bringing your elbows as high as you can. So I just repeatedly go through this motion, changing my posture from a forward bent position to more extended position. As you go back, you can see where my elbows are. When you go back, your elbows will want to do this. All right, opening the elbows, and we've lost that effectiveness of this joint mobilization, and we're just really stretching soft tissue. So to get to the joints in the mid-back, we want to be as tight as possible. You might feel some cracks in there, and that's fine as long as they're pain-free, okay? And typically, I have people do this for 30 seconds, just repeatedly going through that motion, all right? The next one is addressing the other part, the hip. Now, for the lower back, typically, if we spend a lot of time sitting, our hip adapts to this bent position. And after a while, this is so common, I hear this all the time, probably like once a day, that when people stand up out of the chair and try and straighten up their back, it feels very stiff, right? Very stiff, very difficult to go from a bent position where you're sitting comfortably. Usually people don't have that much back pain sitting, but it's difficult that they have pain with standing. What happens is that the tissues and the muscles in the front part of the hip get very, very tight. And the muscles on the back part of the hip, what you're sitting on, become tenderized pretty much because of the body temperature and the weight. If we have any piece of meat, we put it in a pressure cooker, which increases temperature and provides pressure, we get a tenderized piece of meat. And that's what happens with prolonged sitting to your glutes. Now, we need to activate that and also loosen this up, because when this is tight, as you go to stand, your body runs out of room because of the tight hip. It can't open the hip or activate the glute muscle sufficiently. So to stand up, what happens, here's an exaggeration, is that your back does this, and then we exaggerate the activity of the muscles of the lower back, and that's why it's so difficult to open the hips and get straight. All right? So our stretch is basically going to sit like on the side of the chair. So I take the chair, I scooch over, I'm facing one way, I've got an armrest to hold onto, and I create this shape with one knee and hip. I bring this back, okay? So I sit up tall, and if I drop this knee down and pull my ribs down a little bit, activating the core, I should feel a little bit of a stretch here. So the stretch here opens up and counteracts that flexed hip position. 30 seconds is the recommended time to hold this to get that stretch. This is also typically seen in a half kneeling position. If you can tolerate getting into this position and working at the same time, and getting the stretch perfect, right? It's about exploring options and changing positions so that you have this movement vocabulary that you can stay deep and robust, that we don't have only one dimension where our hip or our body can get into. So 30 seconds of opening up the hip sideways in our chair, that'll open up the hip flexor, all right? As for the neck, what typically happens is, again, we have this rounded shoulder position. Our thoracic spine is bent forward. Our head, to counteract that, has to extend a little bit. So we have this shortening of the neck with the chin out and the head forward, right? So we have this kind of Cro-Magnon position. Oh, and we want to get that out. So I like to get back to our base here, get my hips all the way back in the chair. Make sure I'm in the camera. And then sit up tall. And our first move is, without moving the shoulders, just bring your chin backwards. And it's almost like you're giving yourself a double chin. All right. So here's the side view, going backwards and forth like that. And here's the front view. It's a very small motion, and oftentimes people will say, hey, I hear a lot of cracking, snap, crackle, pop when I do that. That's fine. Joints move. As they move, they might make some noise. That's fine, as long as there's no pain associated with the noise, or the joint doesn't lock up and then creates that noise, all right? And also, all the joints that we're moving are super close to our eardrums. So yeah, you're gonna hear something, and that's fine, all right? As we're doing this, the big thing is again, 30 seconds, we're not gonna go pulling your chin back like this. So we're not looking up, all right? Oftentimes we'll get tight through here, and then to do the chin tuck, like, you go looking up. We don't want that, we wanna be straight. Okay, so that kind of is a postural reset to get back into this position. Head over shoulders. Now, the next one is gonna be stretching the front part of the neck. And typically people have a tendency to lose this extension and be tight in the front part of your neck because of this position. So you're gonna hold onto your ribs or actually the first rib and your collarbone, right? So you're just gonna put your fingertips right there, just slightly, don't have to pull it down, right? It's just enough that your arm weight will stabilize that segment. And then you're gonna look up, mouth closed, don't open the jaw, and you're gonna look up, okay? If you can tolerate going up to that position and it doesn't hurt, you feel the stretch in the front. Again, whenever we wanna try and lengthen tissue, we're gonna hold that end range for 30 seconds. Okay, so you're gonna hold that position, and then your hands, your fingers are basically anchors to maintain or hold the bottom part of that muscle, bottom part of that tissue down as you stretch it overhead, right? So you should feel that lengthening there, all right? Holding it 30 seconds, or if it's too much to hold it, you can kind of go through that motion for 30 seconds a pop, all right? The next one is a pretty classic upper trap stretch, because, if our elbows are high or we're resting, or even if we're stretched, the shoulders tend to come up by the ears. And this muscle here, it's part of the trapezius muscle, which is larger, that goes all the way down to the mid-back. It has a tendency to get tight. So the upper trap stretch, I'm gonna scoot forward a little bit so I could hold on to the bottom of the chair. And what that does is it keeps the shoulder down, stabilizes the end of that muscle, and then I'm gonna pull the head sideways. I'm gonna pull away. I should feel a stretch through here. Now, key points with this is because of our things that we talked about, our posture where the head is forward like this. If you pull this, that's gonna be different than if we combine this with a chin tuck and then go sideways. There's a difference there, right? So here, head forward, we've got a lot of slack. I might feel it, but it's not effective, all right? Here, again, posture, head over the shoulders, lined up, and then that creates a much more effective stretch as we create stable points of the beginning and end of that muscle stretching out through there. That's gonna be 30 seconds. Take a breath, deep breaths in as you're doing that. All right, we talked about the chin tuck. Another one to kind of draw in a lot of these postural muscles. And I find a lot of my clients have very poor endurance of these postural muscles. So they'll get to the position, this ideal straight position, and they'll get really, really tired. They can't hold it. It's like, oh, I feel a cramp. I can't hold it. They're very comfortable with just being relaxed, and we just hang out on the ligaments in our joints when we're in this bad position. So the Brugger pose is our next exercise. We're going to scooch to the edge of the chair, and our fingers are going to be pointing to the ground with the palms rotated forward. And as I rotate my palm forward here, it pulls the shoulder blade back. And then I'm going to push my shoulder blade down or fingers to the ground. So I'm going to rotate the palms forward, push my shoulders down, pushing my fingers into the ground, maintain that tension. You should feel that down low in between the shoulder blades, and then combine that with the chin tuck. So we see, all right, what does that feel like? Do we feel tension down low between the shoulder blades and a little bit of a chin tuck, and then pushing the top of your head to the ceiling as we're pushing here? So we have this counteraction, counter strain here of fingers pushing down and head being tall, spine being long. And we see, can we hold that for 30 seconds? All right, so that's a good postural reset, sets those muscles, activates those postural muscles, and kind of creates a better brain to muscle connection to wake them up and says, hey, brain, or hey, muscle, you can work, you need to work to hold yourself up against gravity. All right, so we've got that. So those are simple exercises that you can do just seated. Now, the more advanced things we could add super quick is using a band or some type of exercise resistance or whatever to combine everything that we talked about, right? So we've got this shoulder blades back and down, chin tuck up, head nice and tall, and then we can kind of do this, elbows straight, pulling the hands apart. So I'm basically activating those postural muscles in between my shoulder blades as I'm moving through this motion here to add resistance and further activate those muscles. I like to have people do it for 30 seconds, and maybe the last 2 or 3 repetitions, I will hold it. I'm going to hold that and see, hey, can I hold that for 10 seconds? Right? Activate those muscles and make sure that we're not losing all the other parts that we just built upon to improve your sitting posture. All right? So that's a nice and easy thing. And the other thing too is I like to add in for the lumbar spine is, again, just movement, right? And changes of position. So a lot of patients that come in to see me that have lower back pain that need to sit for their job, I have them do a slouch and overcorrection. Now, this is tricky because this might be very stiff that you don't have the motion required, and then you start to do one of the shoulder things, okay? So to set up, we have our feet flat, hands are gonna be on the knees, that's our bracing point. We have a buttress with the arm. We're gonna keep the head and shoulders still. And then you're gonna slouch by tilting the pelvis back. Tailbone comes underneath you, hopefully you can see that. And then you sit up and overcorrect, tailbone comes out. Hopefully, let me pull this out so you can see. So it's slouching, right? And the movement happens at the pelvis and the lower back. I feel like my pelvis is tilted backwards, and then I tilt my pelvis forward. Head really doesn't move, shoulders really don't move. So I have people do this like at least every 30 minutes, right? So our goal is to keep moving at least every 30 minutes. Don't sit in a prolonged position for too long. Every 30 minutes, maybe do like 30 seconds of this. And then also as a posture correction, it tells us, all right, where's our end range of posterior and anterior tilt? So this is the posterior tilt of the pelvis. And then this is the anterior tilt of the pelvis. So we see where is my range of motion? And then can I find my neutral, my middle? And neutral is ideally where we like to stay and have equal stress on the front, back, muscles, and joints, right? Versus kind of like all the way at the end range where you're slouched. So maintaining a good position, finding that neutral and sitting, and then doing that. And again, every 30 minutes, we want to get up and move.